In our continued battle of the sexes, who has it worse? Do women hurt more, or do our male counterparts experience worse? I mean, this is the age-old debate after a pint or two at the local bar. On one hand, we have women doing the impossible, like pushing out a watermelon-sized object through a coin-sized hole. But on the other hand, a swift kick to the family jewels will leave men highly incapacitated. Well, at least for a while. Unfortunately, you're human, and you're most likely either male or female, so it'd be impossible for you to experience both childbirth and getting kicked in the balls. It seems there is no real way for us to accurately compare which might be more painful. Researchers at UCL decided that as opposed to gender-specific pain, chest pain, also known as angina, is a much better comparison of pain perception between men and women. Results concluded that men and women use vastly different verbal terms to describe their pain, making it extremely hard for clinicians to translate this for any clinical practicality. Verbal and numerical rating scales and visual analog scales are common tools that clinicians use as an attempt to quantify pain, but these tools are rendered useless as pain, depending on gender, individuality, or even cultural background, is a highly subjective term. To really evaluate this question of whether women or men hurt more, we first need to understand what pain is, and this in itself is not an easy task. Pain can be roughly categorized into physical pain and emotional pain. But more importantly, these can combine to make up our overall pain experience. For example, as a child, you loved riding bikes in your backyard, but one day you fell over and made a deep cut that was only fixed 15 stitches later. Physical pain could be the short-term burning sensation you feel emanating from the injury site, while emotional pain would contribute to your long-term fear of needles, unfortunately making you the notorious 20-year-old crybaby at your annual physical.
In the human body, there are a group of specialized nerve cells on the surface of the skin called nociceptors, which readily react to pain. Unlike the typical nerve cell that readily fires in response to touch or temperature, nociceptors will only fire once a specific pain threshold has been reached. Nociceptors respond quickly and send rapid signals to the spinal cord and brain, allowing you to feel pain. More importantly, this triggers a descending pathway, which allows you to react by moving away from the painful stimuli. Signals from nociceptors travel to the brain via the spinal cord up the spinothalamic tract. The signals are sent to the cortex, allowing you to accurately locate where the pain in your body is coming from. Physical pain has two components, the sensory part and the affective part. The sensory component relates to the physical aspects, such as the location, type, and intensity of pain. The affective component involves how we interpret the pain. For example, how much does a nail in the foot bother you? It is the affective aspect which makes us try to stop the pain, like holding your impaled foot. It is important to understand that these two components of physical pain activate different regions of the brain. In this way, we can analyse them separately. Studies have found that there are differences in the physical pain pathway between men and women. In brain cells called microglia, a specific pain receptor called toll-like receptor 4 is involved in neuropathic pain in male mice. However, this receptor is not found in female mice. In fact, female mice use an alternative pain pathway by recruiting immune cells called T lymphocytes. Physical pain can also be regulated by hormones. Because men and women have different levels of hormones, their experience of pain may also differ. In women, there are cycles of estrogen fluctuations, and the greatest amount of pain is reported during this period of time. Interestingly, after menopause, levels of estrogen become lower and do not fluctuate as much. Therefore, sex differences in pain have become less obvious. So, what about emotional pain? Reports suggest men have lower sensitivity to chronic pain compared to women. Perhaps men are supposed to feel less pain and be more manly. One example of emotional pain is a breakup. 5,705 participants in 96 countries were tested on the physical and emotional aspect of their pain. They saw that women showed higher levels of physical and emotional pain than men. To explain this, a controversial theory was suggested. Breakups may hit women harder, but they recover fully and come out emotionally stronger. However, men, on the other hand, never fully recover. They just move on. These differences come down to evolutionary biology. Females have evolved to invest far more in a relationship than males, as an encounter can further lead to pregnancy. This risk has made females select for high-quality mates, and therefore a breakup hurts them more. Males, on the other hand, have evolved to compete for the attention of females, so losing a high-quality mate does not hurt them as much, but they feel the loss for a very long period of time, as they realise that they must compete all over again to replace what they have lost. From the survey, researchers also observed that women experience greater physical pain. Therefore, they can suggest some connection between physical and emotional pain. Although physical and emotional pain are categorised, they work together to produce your overall experience of pain. People around the world use the same words, pain and hurt, to describe both social rejection, a form of emotional pain, and physical pain. So, exactly how similar are these two experiences? To investigate this question, researchers studied a population of people who all encountered an unwanted romantic relationship breakup. Each participant was subjected to two tasks, a social rejection task and a physical pain task. The social rejection task involved viewing a photo of their ex-partner and being reminded of this heartbreaking experience. The physical pain task involved experiencing unpleasant thermal stimulation on their arm. fMRI analysis of the brain revealed that in both tasks, regions of the brain that typically supported the affective and sensory components of physical pain were also felt in social rejection. These new findings showed no substantial difference between men and women, which makes us wonder if there's a difference at all. But then again, the sample size was only 40 participants, so you could argue that this isn't significant evidence to disprove gender differences in pain.
The biggest dilemma we face in hospitals today is that doctors cannot accurately understand how much pain a patient is in. Verbal descriptions of pain could differ between patients depending on their gender and their culture. Research has reported differences in the language used to describe painful experiences by men and women. It is indicated by content analysis that women tend to use more graphic language, focusing on sensory aspects of their pain event. Men are less likely to use these descriptive phrases and focus on emotions. As shown in the figure, almost all descriptional words of men reflect an emotional aspect of pain. The group swear words and anger-related emotion words lie closer to the men's tag, while those that reflect the sensory qualities of pain lie closest to the women's tag. Men's description of pain focus heavily on the emotion of anger, while women's description of pain often involve pain adjectives like sharp, dull, and ache. So, are women just less tolerant of pain than men? It is a common belief that women exaggerate pain due to their so-called hysterical nature, and the consequence of the stereotype is that female patients are often taken less seriously for pain treatments compared to their male counterparts. It is important to understand if there is a difference in pain perception between men and women. Medical pain research has historically been conducted on males, and they failed to recognize any potential sexual differences. These differences would greatly change the outcome of many of these experiments, making these drugs and their dosages highly variable depending on gender. We are moving towards an age of personalized medicine. Perhaps an appreciation for sex differences will further this cause by making drugs that have fewer side effects, which are ultimately more effective.